doing rural medicine is probably the most natural thing. If you've ever thought about being a medical doctor and truly doing what medical doctors do, rural medicine is the place to be.
Well, you have to step out of your comfort zone, because if you don't, then you miss out on the adventures. And rural practice is an adventure.
You just get to see a lot more than maybe you would at an urban site. So the scope of practice of like the physicians here is just really wide and allows you to kind of get to see a lot of stuff that maybe you wouldn't if you did it in the city.
You can do emergency room, critical care, trauma care, obstetrics, occupational health, anesthesia, you name it.
I take off bumps, or I assist in the operating room. I deliver babies. I manage MIs. I see patients with everything from worried well to very serious illnesses. And I never know what's going to happen. That's one of the challenges and one of the real joys of the job. You never know what tomorrow or even the next patient is going to bring.
Going out to a rural environment to try it is worth your time. No matter what, you're going to have a great educational experience. You're going to have a preceptor who's going to work with you in a one-on-one way, who's going to be very dedicated to your success. And trying it on for size, sometimes you find that you like it a lot more than maybe you'd initially considered. So I'd encourage everybody at the Cummings School of Medicine to think about doing some of their clerkship in a rural setting. I think it's a great learning opportunity.
If someone gets sick and needs help, we are it. And you deal with it. Things you didn't know you were capable of doing, you do.
You can be whoever you choose to be. It may seem a bit daunting at first because you think, oh, any type of patient can walk into your room, right? But that's the fun part. I like being the detective.
And rural medicine is not just about being able to do procedures properly and being an expert. It's about communications, it's about collaboration, it's about being precise in how you see your patient's context, the social determinants of health. You get all of that through your rural rotation, which you are not going to get integrated in any other place inside a city.
You will never be as confident, in my opinion, coming out of a family med urban experience as you will family med rural. Never.
I do love it. It's kind of the perfect combination of like emerge plus family, plus kind of inpatient stuff. They let you do a lot more. The preceptors are kind of right there. It's one-on-one. They trust you a little bit more. Definitely give it a shot and explore it.
And I think that the big difference for me between this rural experience of working one-on-one with a dedicated preceptor, I really find that she really pushes me in a positive sense. Like she knows where my learning edge is and she knows where I'm comfortable and where I'm uncomfortable and helps me grow into those places that I hope to grow into.
The biggest thing that you get from a rural exposure, yes, you learn clinical skills, that's really important, but you can take that anywhere, but they get to see what the lifestyle is like.
The doctors here aren't just doctors, they're our doctors. They're people we know, they're our neighbors, they're our friends, they're the coaches of our kids' sports teams. We know them individually and personally as well as through healthcare services, and it's pretty amazing to have that kind of relationship.
I find that it's incredibly flexible for what I want to do. I have time to exercise every day, and so I feel really fortunate that I get to do the practice that I want to do and have a really fantastic lifestyle.
It's so nice to, one, not waste 15 hours a week of my time driving. It's quite nice and relaxing and not pay for parking.
So we don't have all of the big amenities and services that the larger centers do, but what we do have, we have the mountains, we have the creeks, we have the lakes, we've got fishing, hiking, paddling, all these things right at the back door. And so that's where you end up spending your time.
But if you really like medicine, like I said at first, if there's something that made you want to go into medicine, rural medicine is where you will really get the experience and the satisfaction.
If anyone's feeling a little bit burned out or just needs some more renewed hope, try an elective in a rural area or just get out there and see what the practice is like, because it can vary in different places. So I find optimism and hope is so present here, and that's wonderful to take into a future career.